Someone asked me this question recently. Is this procedure available in Australia for people with low back pain? This is my answer. Artificial disc replacement has been available since the 90s. I've performed numerous. It doesn't offer anything more favorable than lumbar fusion. NeuroHAB is orders of magnitude better with zero risk. I avoid anterior lumbar spine surgery unless there is absolutely no other option because of the very real risk of death from massive hemorrhage and in male sexual dysfunction from damage to the pre-lumbosacral autonomic plexus of nerves in front of the lower lumbar discs and vertebral bodies. All valid interventions including NeuroHAB, fusion and artificial disc replacement for LBP fundamentally pursue stability of the motion segment. All interventions including NeuroHAB will fail for the following fundamental reasons. 1. If stability can't be reacquired. 2. Persistent post-surgical pain from tissue damage or surgical complications, which is generally around 1 to 5%. 3. Adjacent segment-driven pain shortly after surgery. And 4. Unresolved central sensitization. When delivered in a timely manner, NeuroHAB carries the most favorable outcomes because it targets all of the factors that lead to chronic low back pain with zero risk and tissue injury.